So we launched a project which offers a listening and befriending service, but we also do events outreach. Our listening service is a free phone number, which is 8000, and people can contact that number Monday to Friday, 6 p.m. to 8 p.m. Our befriending service is where you are matched with a person of similar interests, and you can receive a telephone call from our charity every week that's convenient to you, and you effectively have a telephone pal. So sort of like a pen pal, but via the telephone. And our third strand, which is our events outreach, we do weekly coffee mornings, we host specific events, and we get a lovely group of people that attend. We're always welcoming new people. This month of January, we've only had one so far this year, and we've had new people attend. So that shows us that there's a need for this service specifically around this time of year as well, if we're getting an influx of people.
We definitely see January blues in a lot of people, not just people who are in hospital, but in our community and our families. Quite often we get the build up to Christmas, which is usually very, very busy. People are hectic, usually visiting lots of family members, and there's a lot of activity going on. Post Christmas, we see a big slump in ourselves, in each other. The days are longer, it's darker, we don't want to go out as much. We might have some financial pressures from Christmas. You know, there's a lot to be said about all the expectations on everybody. Increasing socialising, that brings a lot of costs. Presents and the need to provide gifts for everyone or expensive presents. Maybe putting unnecessary pressure on ourselves with our New Year's resolutions, that kind of thing. So all these extra pressures, and I think January is a slump for a lot of people. Going out for a short walk, go for a walk in your lunch hour, making sure we're sleeping properly. You know, we're not up all night and going to bed really late. Getting ourselves back into a routine. Eating and less alcohol, things like that will all help.
What protective factors is like? It is like nutrition. It is getting sleep hygiene under control. It is seeking to support, and it's a kind of what we call social prescribing model. You know, what works for someone, it might be, joining a club. A club might be sort of like a crochet club, a knitting club, anything what basically gets you connected to someone as connection, which we're looking at. Sometimes we have to be careful because some people don't like too much connection. So this is why when it comes to wellbeing, mental health, it has to be tailored to what is person-centered. It's what you need. But the good news is that we've got so many things going on in the community that we can reach out, and we've got lots of wonderful things going on. Those are the ones what we need to focus on, our protective factors, and enhance them.